My name's Anthony Marren. I'm one of the accredited fertility specialists here at Genea. So I've done my obstetrics and gynecology training. I've also done a Masters of Reproductive Medicine and Human Genetics, and I'm also subspecialty qualified in reproductive endocrinology and infertility. I do all my procedures here through Genea Kent Street CBD. My main rooms are over at St Leonards, so Sydney's North Shore, and I also consult once a week here in at Kent Street. Like most people, I chose obstetrics and gynecology largely due to the excitement of obstetrics, and it's also very interesting in terms of it's a nice balance of medicine and surgery, and there's challenges with having two patients being the mother and baby. I don't do obstetrics now. All I do is fertility and fertility related surgery, but fertility really comes out of gynecology as a specialty. Fertility is relatively new, and it's certainly an area that is sort of rapidly advancing, and certainly working in the field, you know, we've had huge changes over the last sort of 10 years which have resulted in improved patient outcomes, and so it's a really exciting sort of area to sort of work in. I did my fertility training in Sydney's Royal Prince Alfred Hospital, so it's in the public setting. And I've chosen to work with Genea in a private capacity. And the thing that's really sort of made me want to consider Genea is largely the amount of time and money that they've invested into research. Genea has been a leader in fertility for some time. We've certainly, you know, been at the forefront in terms of chromosome screening of embryos. We have our own in-house culture media, we have our own incubators, we have our own freezing system for freezing of embryos, and we can only really achieve the results that we do achieve by that investment in research. And so that's the main reason why I've chosen to practice solely with Genea. I really enjoy and I'm passionate about you know, providing as best possible care to my patients as possible, and certainly that desire to sort of have a child or a family is very natural and innate, and is a really strong sort of desire, and to try and help patients actually achieve that is incredibly rewarding. So for individuals or couples that are wanting to embark on the fertility journey, I honestly believe that the first step is they should go and find and see a general practitioner. You often find that people in their teens, 20s or 30s haven't seen a GP for some time, and hopefully the outcome is successful and you have a child, and certainly when you have a child you're off to the GP all the time, so establishing that relationship early is really important. The GP can take histories, they can do some basic investigations, and if they identify any sort of issues right up front, they can refer you on straight away. And so I do think that that's really the most important step. What we usually say is that if you are young, so less than 35, you should try for up to about 12 months. If you're over 35, you should seek help at sort of 6 months. Obviously, if there's any pre-existing problem that would be concerned, then we'd want to see people straight away. Or obviously, if people are just sort of anxious about things, we're happy to see people and sort of reassure them. But still, I think seeing that GP, going through some basic history and investigations and getting that relationship built, I think is important. Married with two young kids, so my kids are 12 and 9, so the kids really sort of keep me busy, so ballet and soccer on weekends, and certainly they are a huge part of my life. In as far as personally, I like reading, I like cooking, I was learning the violin, and I often sort of say that's the most difficult part of my week, and I also like travelling.